Friends, again I want to talk to you on a very general subject, a subject concerning all the individuals. So it is about the blood, the diseases of the blood, and the diseases of the blood vessels. Again, I want to make it clear that I am not a doctor, I am not a medical professional. It's all the information collected from different sources for our own information and use, which, of course, most of us would also be knowing, and I would like to share it with you now. See, coming to blood, we all know that blood is a warm red liquid made up of many different things. It is 5 times thicker than water, and therefore it requires more pressure for keeping it in circulation. And the blood has to be in circulation throughout, otherwise, the man will be out. And 1/14th of the total weight of the human body is made up of blood. That is, if my weight is 70 kgs, at least 5 kgs would be the weight of the blood. And blood flowing in the veins and the arteries, it's a living tissue. So little less than 50% of it consists of red blood cells which carry oxygen to the tissues and remove the excess carbon dioxide from the system. And it also has white cells. The red blood cells, they are about 50 lakh per cubic millimeter, whereas white blood cells are only about 7,000 to 9,000 per cubic millimeter. And life of red blood cell is only 108 days. And the white cells, again, there are different types: the leukocytes, the monocytes, the lymphocytes, the eosinophils, basophils. So these are all the white cells. The leukocytes, they fight against the germs, destroy them. Both the leukocytes and even monocytes, they do the more or less the common function. They fight against the germs, destroy them, and doing so, they also die. Some of them, not all, but they also die and form pus in this swelling. And coming to the lymphocytes, they maintain the body's resistance against the disease and they keep us well. And the eosinophils, they help the body to handle the various toxic substances in the intestine. And the basophils, they liberate the heparin into the bloodstream and prevent the blood from clotting. So all these, various cells constitute about 40% of the blood, and remaining 60% of it is plasma, that is the liquid portion. So this liquid portion or the plasma of portion of the blood, it contains the proteins such as the albumin, globulin, fibrinogen. So it also contains the glucose, the food element, and several other chemicals. Glucose provides energy and fuel for the cells. So blood is not a simple liquid but a very complex substance. And all different elements, they must be kept in constant balance so that the body gets the right material in right amount at the right time. So the blood circulates within the body through a special network of the living tubes known as the arteries, the veins, and the capillaries. So the pure blood leaving the left side of the heart, it is carried to the tissues through aorta. Its large and its large number of branches, namely the arteries, and finally through very small capillaries to the individual muscle cells of the body. And after leaving the capillaries, the blood travels through the small vessels or the veins that merge into larger and larger veins until it reaches the right side of the heart and then to the lungs. So from there to the left hand side of the heart. So thus completing the circulation of the blood. So in the arteries, the blood is pumped under pressure. So which can be readily measured by means of blood pressure cuff. It may be 120/80 or 120/70. So blood flowing through the veins, it is not under any pressure, but it finds its way back to the heart with the aid of the valves in the veins. So the contractions of our muscles and the breathing motions of the chest. So that is why when an artery is cut, so that only brings back the blood to the heart and lungs. So that's why when an artery is cut, blood shoots out with pressure according to the rates of the heart with all speed. Whereas when a vein is cut, blood comes out in a steady stream under no pressure. So, like all other tissues, the blood vessels, they are also made up of cells and they are subject to certain diseases or disease conditions. Now, let us see what are the diseases pertaining to the blood and the blood vessels. So, first, when we say a disease very much pertaining to the blood, what flashes to our mind is the anemia. So, anemia means if red blood count, cells count, it is less than 50 lakh per cubic millimeter, then we say it is anemic condition. So anemia happens even due to the hemorrhage, heavy menstrual bleeding, slow bleeding from an ulcer in the stomach or intestine, due to loss through the urinary tract, due to the destruction of the spleen, and even malaria attack, etc., etc. And there is also what is called as the pernicious anemia. So in this case, the blood cells are larger. You see, blood cells are larger, but their number is less. So fewer number, lesser number. So only 10 lakh instead of 50 lakh. So this is only an example. So only if there are say 10 lakh cells instead of 50 lakh cells per cubic millimeter, it may result in the pernicious anemia. So it may be 10 lakh, it may be 8 lakh, it may be, 15, 20 like that. So trouble arises because of the fact that they are not present in sufficient quantity in the intestine to absorb the B12 from the intestine. So frequent B12 injections have to be given in this pernicious anemic condition. And there is also another anemia called the iron deficiency anemia. So the level of iron is less due to the chronic blood loss or iron not properly absorbed. The stomach is not producing sufficient, if it is not producing sufficient hydrochloric acid, HCl. So the symptoms are weakness, easy fatigue, irritability, heartburn, the flatulence, etc. They are felt when there is iron deficiency anemia. And there is also what is called as the bone marrow anemia. So certain factors like the infection, inflammatory conditions, tumors, arthritis, toxic substances, the cancer of bones, etc. They may also interfere with normal production of the red cells, even the X-rays, the atomic radiations, etc. They may also be responsible for this. So the blood count in this case, it may drop below 20 lakhs, below 20 lakhs, the RBC. And the white blood cells may also drop less than 1000. So in this case, so instead of 7,000, it may be less than 1,000. Instead of 50,000, red blood cells may be less than 20 lakh per cubic millimeter. So blood transfusion is required, and vitamin B2 injections are also required. Then there is also what is called as the polycythemia, we call polycythemia. So slowly progressive disease, this one. So where the red blood cells the count, it goes above 100 lakh cubic per cubic millimeter. So here on the contrary, it is not falling down, but it is going up. So instead of 50 lakh, it may go beyond 100 lakh RBC. So it results in headache, weakness, dizziness, the abdominal pain, etc. And even strokes are also fairly common. And the skin appears in this case very dusky and blue. And it also happens due to the uh, what we call as the congenital heart diseases, means diseases right from the birth if there are any. The chronic lung diseases may also cause this. So excess blood in this case is to be removed at frequent intervals instead of Giving blood, we will have to remove the blood, radioactive phosphorus, this P32. So it is to be injected into the blood to control this. And there is also another disorder called as the purpura. So in this case, the walls of the smaller blood vessels, they become dilated. That means they become thin and they rupture. Then they break, causing local hemorrhage. So to stop the hemorrhage, you will have to apply local pressure, application of ice over the affected areas, etc. And more importantly, the leukemia. The leukemia, this may be due to some virus called the blood cancer. So this is the condition where we call this blood cancer. It may follow excessive exposure to X-rays due to certain chemicals relating to benzene group, etc. And they produce excessive number of white blood cells. The white blood cells means the granulocytes, lymphocytes, monocytes. So it results in the weight loss, fatigue, weakness, lack of the appetite. So as the bone marrow is overcrowded with the white blood cells, in this case, there will be loss of red blood cells also. So 7,000 per cubic millimeter, it may rise. The white blood cells number may rise to 25,000 or 50,000 or even 2 lakh. So there may be pain in the bones and the hemorrhages in the skin. So the outcome depends on the type of leukemia. So overactive bone marrow should be depressed by certain drugs. X-ray treatment over spleen, bones, lymph nodes, and other tissues, they are often effective. So here again, the condition, if it is the number is too large, then it becomes too difficult for us to control. It becomes complex. If it is good and not that large, it can be controlled. And there is a disease called as the Hodgkin's disease. So this is a chronic disease. Swelling in the lymph nodes along the neck is the first indication. Usually there will be no pain. In some other cases, the spleen and liver will be enlarged and tender. So later stages, high fever and a peculiar bronze pigmentation of the skin occurs. There is no cure yet for this, but X-ray therapy may help to shrink down the enlarged lymph nodes. So good nursing, balanced diet of proteins and vitamins, it may help in this case. And there are also, a few other diseases that may not be worth mentioning here. So then we shall come to the diseases of the blood vessels. See, more commonly it is the arteriosclerosis. So it is nothing but hardening of the arteries due to the presence of calcium. It may be due to excess calcium, it may be due to fat diet, rich in cholesterol, maybe due to diabetes and the hypothyroidism and nephrosis, obesity, etc. So saturated fats around, the saturated fats, they collect here. So it increases the level of cholesterol in blood, while unsaturated fats such as this, see, the meat, egg, yolk, the milk, fats, etc., they increase the level of cholesterol in the blood. Whereas they are all the saturated fats. So whereas the unsaturated fats such as the soya bean, sunflower, groundnut, the uh, the jingly cotton, the jingly cotton seed, and maize oils, they may even lower the blood cholesterol level. So high BP, emotional stress, they also play an important role in the wear and tear of the vessels. So if blood vessels are damaged by disease, blood cannot move freely. So blood clots also, they may also form completely blocking the flow of blood. So if it is coronary arteries, short pains of angina or the coronary thrombosis, arteries leading to brain, they are involved. So vessel may burst leading to hemorrhage or it may result in blood clot or leading to the stroke. So such damage happening to the blood vessels in the legs may bring pain in the legs even after a moderate walk. So if vessel is completely blocked, it may result in gangrene. So narrowing down of the blood vessels in the legs, that is called as the intermittent claudication. So moderate exercise, again avoiding tobacco, reducing the weight, the lower cholesterol level, lowering the cholesterol level, nicotine acid and thyroid extract, of course, these are to be done, and the nicotine and the acid and the thyroid extract, they seem to have the condition. And the French, even what we generally, they hear about the pelvitis. So this is the inflammation of vein occurring in the lower extremities. So, your milk, egg, generally, they may also cause this due to the fats in that. And it may also be due to some injury or by birth also it can happen. So trouble usually begins with a clot preventing the blood flow from that area. So if this clot moves into the lungs, then it causes the pulmonary embolus, which is a serious condition. We have to prevent that. So hot water treatment, etc., should be given, but no massage should be given as clot may split into more clots and lodge in lungs, etc. So blood thinning medicines are of value in treating this. Surgery also is advised. Then more importantly and lastly, I would like to touch upon the varicose veins. See here, the arteries are very strong and tough, whereas the veins, they are thin and weak. So all blood returning to the heart passes through the veins. The blood flowing from the head and the upper chest flows downward towards the heart. And it also results in the blood coming from the lower extremities. So they must flow upward. So to make this possible, the nature has provided the valves in the veins so that blood can flow only towards the heart and never in the other direction. See, in our legs, we have two main sets of veins. Deeper veins are located within the muscles, and but there are two main sets of veins. One is deeper veins located within the muscles, and they have got very good support. But the veins on the surface of the muscles, they just under the skin, they have little support, and they are easily damaged and are often subject to the inflammation or the phlebitis. So these swollen veins in the legs, they are called as the varicose veins. So they are ugly and dangerous. And also, as blood clots formed in them, it may break off and travel to the heart and lungs. So surgery is the best treatment, especially when the large veins of the legs and thighs are involved. And no plastic bands should be worn, antibiotic ointments and laying legs above the knees. So this roll well in bed and some gentle heat treatment will help. And the Burger's disease, it's a very painful disorder of the toes and feet, especially due to excessive smoking. It happens. There'll be burning in the feet or toes. It may also involve the fingers or hands, and feet appear red or dark, and the skin above it looks pale than normal, and gangrene and ulceration may also then develop. So one must avoid smoking, also extremes in temperature, and poorly fitted shoes should be eliminated. So you will have to elevate the legs while laying down for some time, come to normal position, again elevate for some time, repeat it. So this is how it is to be treated. And there are also so many other therapies and the surgery possible for, to treat this. So thank you very much, friends.